Good evening, and welcome to 351 Action News, where we've got the news for lose. I'm your host, Cheyenne Carey, and tonight the Action News team brings you a special report on the critical and challenging field of flight nursing. Join us as we explore care in the air. Our coverage tonight will include an interview with an active flight nurse and a behind-the-scenes look at a real air ambulance, courtesy of Hawaii Life Flight, so stay tuned. So, flight nursing. Flight nursing is the specialized nursing care provided to critically ill patients who need to be transported rapidly to specialized facilities, often because the regions in which they reside lack the necessary medical care for their illness. As you can imagine, this is of unique importance to Hawaii, and the Hawaii Islands in general, because of the growing populations in rural areas which, while breathtakingly beautiful, are critically underserved. For more on the importance of flight nursing, here's Fernanda.
As Cheyenne briefly mentioned, flight nursing is a specialized field within nursing where healthcare professionals provide critical care during patient transportation via air, whether by helicopter or fixed-wing aircrafts. Flight nurses are highly skilled in managing emergencies, stabilizing patients, and ensuring their safety during air medical transport. They are often the first responders in remote or challenging areas, playing a pivotal role in saving lives. In addition to physical care, flight nurses must navigate high-pressure, resource-limited environments. Flight nurses collaborate with paramedics, EMTs, and physicians to stabilize and transport critically ill or injured patients. They also coordinate patient transfers between facilities, ensuring safe transport and communication with receiving teams. Their role is vital when ground transport is not an option. Flight nursing history. During World War II, the U.S. Army Air Forces developed air medical evacuation to quickly transport wounded soldiers to hospitals, saving countless of lives. In response to urgent needs, the United States Army Air Forces trained flight nurses at Bowen Field, Kentucky. Despite their belief that Special Corps of aerial nurses should not be trained in military services, they quickly realized that nurses trained in the care of critically ill patients could dramatically increase available medical care during air medical transportation. This led to the first graduating class in 1943, led by Second Lieutenant Geraldine Dishron. Flight nurses volunteered for dangerous missions on unmarked aircraft, trained in survival and high-altitude care, and served in 31 squadrons worldwide. Of over 1.17 million patients evacuated, only 46 died en route, thanks to the nurses' skills. Unfortunately, 17 flight nurses lost their lives during the war. Moreover, these efforts led to the development of air evacuation, known today as air medical evacuation, and flight nursing.
To become a flight nurse, you first need to earn a nursing degree. It can either be an associate's degree or a bachelor's degree. Then after that, you would need to pass the NCLEX exam. And then most flight nursing positions also require a minimum of 3 to 5 years of critical experience, such as working in the ICU or emergency department. In addition to that, flight nurses often pursue advanced certifications like basic life support, advanced cardiac life support, critical life support, and all those stuff. The certified flight registered nurse is not required to be a flight nurse, but some employers prefer it or may ask you to get it within the 1 to 2 years after you're hired. And then more on the certified flight registered nurse. This actually provides an insight into the critical role of a flight nurse, and it has 7 core components. Number 1 is flight physiology, so understanding how altitude affects the body and equipment, critical care transport, emergency medical procedures, so performing life-saving interventions, communication and teamwork, safety, medical equipment and medication, and patient assessment, so like quickly evaluating and prioritizing patient care during transport. Another important requirement is the ability to work independently in tight spaces while still collaborating with other team members. So they must stay focused and provide excellent care even in challenging and confined environments. And since the job is physically demanding, flight nurses must maintain a good level of fitness. This is essential for tasks like moving patients and handling medical equipment in the cramped space of an aircraft. Flight nurses must also be flexible with their work schedule. And then one last thing is that strong leadership and communication skills are essential. Flight nurses must be able to lead their team under pressure, make quick decisions, and communicate effectively with both their coworkers and the healthcare providers.
Equipment required on aircraft. According to the Air Force Manual 102909, there is a list of minimum required equipment and supplies that are needed on any and all air medical evacuation operations. A little bit about this manual. This manual provides standardized guidance for using medical equipment during aeromedical evacuation missions, ensuring all gear is tested by Aeromedical Test Lab and certified safe to fly for use on aircrafts. It outlines procedures for testing equipment under flight conditions like altitude changes, vibration, and fuel vapor exposure, and ensures crew members understand equipment capabilities and limitations. It also sets clear protocols for managing in-flight kits, supporting safe, effective patient care in dynamic in-flight environments. For the sake of time and for our project specifically, I will be sharing a list of minimum equipment needed on board any aeromedical evacuation. That includes an electrical cable assembly set, cardiac monitor and defibrillator, portable suction unit, in-flight kits, IV infusion pump, oxygen, vital signs monitor, frequency converter, 8878IJ bag, also known as the miscellaneous bag, with items dependent on the patient's condition. In this bag, most of the items are optional, but the backboard is mandatory and must be taken on every flight no matter what. There are also core bags that are required on every flight. These bags contain advanced cardiac life support, pharmacy kit bags, narcotic boxes, and more. Basically, these cover essential medications and supplies needed for most patients, including emergency care and infection control. On top of those, there are specialty kits like those for burns and trauma, and others for pediatric or obstetric care. And actually, later on in the presentation, we have some examples of what some of this equipment looks like.
Here is one statistical study that observed what kind of patients most often needed air medical transport. The top diagnostic categories being cardiovascular, neurological, surgical, trauma patients, and various other medical diagnoses. This same study took count of which resuscitative procedures most often had to be performed during air transport. You'll notice many of these procedures don't fall into the typical scope of practice for a nurse in the average hospital setting. However, the typical air medical flight includes a pilot, 2 nurses, and the patient. There is no respiratory therapist or code team that tags along. Those 2 nurses play the role of every medical department for the duration of that flight. The total care of that patient is their responsibility. It requires an extremely high skill set to be a flight nurse and manage these issues. Let's explore this skill set further. In 2010, Andrew P. Raymer and Shirley M. Moore created a theory of flight nursing expertise through the composition of 9 key concepts. They explored how these concepts related to one another and determined their efficacy in helping flight nurses to provide safe and competent patient care in the best possible way they can. These 9 concepts are experience, training, transport environment of care, psychomotor skills, flight nursing knowledge, cue recognition, pattern recognition, decision-making, and action. Raymer and Moore's theory explored how these concepts would function in a control-ideal environment. Of course, we all know that isn't always the case in healthcare. In 2014, John M. Closhy took the theory and applied it to real flight nursing experience. He used tools such as post-flight questionnaires, interviews, and surveys to determine the actual effectiveness of this theory. Through his study, he concluded the theory held very valuable merit, but was missing a couple key concepts. We added in partner queuing and altered decision-making to now be expanded decision-making to further advance the quality of care flight nurses provide.
Evidence-based practice is integral to every aspect of nursing. EBP improves patient outcomes by prioritizing safety. For flight nursing, specifically, such a large degree of the action they take to keep a patient stable is rooted in clinical judgment. They have a significantly high need for critical thinking, being that their patients are often in serious condition and there's a difficulty performing certain assessment on planes. This adds to additional training and education to effectively perform in this field. Best practice on a plane will be different to other healthcare settings due to the unique environment and challenges it creates. The environment of a plane causes the majority of these challenges. In severe weather, planes can't be flown and patients can be stuck waiting for transport, which can be detrimental to their health. The vibrations, decrease in humidity, and noise contribute to discomfort. Noise levels additionally make it almost impossible to do auscultation-based assessments. These nurses will need to rely on visible changes and changes being tracked on monitors. The limited space in these transport planes means less equipment is available, and when equipment is needed, it needs to be unpacked. There is restricted access to patient due to the size, and the planes are also only large enough to hold a few people, meaning in these flights there is generally either one nurse and a medic, or 2 flight nurses. Contributing to environmental challenges is barometric pressure, which essentially describes air pressure, which decreases as you ascend. This decrease can cause problems with equipment and direct issues for patients. An example being equipment with gas-filled cuffs like endotracheal tubes. The volume of gas within them may expand and cause damage to the trachea. It is integral to take in all of these challenges and know how to work around them.
Thanks, team. And now, without further ado, tonight's feature, an in-depth look at the daily experiences of flight nursing. Our team went on site to the Hilo International Airport to meet with Amanda Scott, a flight RN and Waimea base manager for Hawaii Life Flight. Let's take a look.
Say is your favorite thing about working in flight nursing?
I love the just nothing's ever the same. Like I said, boring is boring, and I don't like boring. And so just every patient's a little bit different. Everybody acts a little bit different in that plane. The plane is different every time, whether it's the weather, the time of day you're flying, who you're flying with. Like it's a constant something exciting.
But it's not like 12 hours with the same 2 patients.
Yeah.
Variety, and you're in and out. You're not locked in the hospital all day long.
Yeah.
So, good variety.
Yeah.
We were wondering, what are some of the complications you guys face most often during a medical
As far as patient concerns?
Yes. Yeah. Issues that come up that you have to face and deal with on the fly.
Like blood pressure.
Yeah.
Like diminishing blood pressure.
Yeah.
And how to intervene that.
Yeah, a lot of things affect the blood pressure in flight, whether that's pressure that causes complications as far as like lungs go, or like just the stress of being in the plane in general causes the patient to change quite a bit. So just managing that blood pressure and that heart rate, I think, are our biggest,
Probably our most
common complication in flight.
Mental status changes too. We do a lot of strokes, so being really watching and monitoring them, pupil changes, decreasing their level of consciousness. That's probably like the 2 biggest ones.
Yeah.
And like doing a really good assessment at bedside, because as we talked about, you can't really assess them very well for changes. Just making sure you have a good initial assessment.
Mm-hmm. Yep. Subtle things, like she said, like the chest looks a little lower on this side than it did 10 minutes ago when we loaded them, or hey, they're breathing a lot faster than they were before we loaded them on this aircraft. Just those little subtle changes can make all the difference.
Okay, yeah. So do you guys do that assessment at bedside in the ER, and you're with them the whole way from the ER to the flight?
Yes, whether it be the ER or the ICU or the floor,
maybe.
wherever we pick them up from, whatever unit, we do a good assessment bedside there. And then typically that assessment continues on the ambulance on the way over, because, again, that's an environment change too, just the back of the ambulance and the bumps of the road and all that kind of stuff. And then probably like one more once you have them fully loaded, just kind of a once over, like, okay, no more new blood, no new anything like that. And then we're really good from there.
One just popped up for me is like, so are they just in a gown when you throw them on the gurney and get them out here, or do they have like a special flight suit?
Nope, just a gown, whatever they were in at the hospital, whether that's,
Slip-ups.
pretty much your birthday suit from being a trauma patient and, covered in nice warm blankets. Whatever the condition is that we take them from the hospital is pretty much what we keep them in. Yeah.
What kind of additional training did you guys have to do to prepare to be a flight nurse, and how would you say that helped prepare you for flight nursing?
So we have a lot of annual training that we do as a flight crew. So we do a lot of like hands-on training with our educators. We do cadaver lab to practice our intubations and our needle crikes and our crikes and our finger thoracostomies. So a lot of hands-on stuff. And then certification-wise, we have to have a flight certification. So you have to have a CFRN within 2 years of starting this job, or for medics is FTC.
Okay, how long does it take to get your CFRN?
However long you put into it.
It's a really grueling test.
It is a very grueling test.
Okay. So you don't have to do a separate program for that. It's just
It's
training.
a lot of studying. Yes.
And
And it's anything nursing, ground, flight. It's a lot of categories
Wow,
that it
kind of
covers.
covers all the
Care.
bases.
Yeah.
Okay,
Yeah.
wow.
And then to get hired on, because we do some advanced techniques or procedures that you can't do as a floor nurse, they train us separately for that. So, like intubations, you can't do intubations in a hospital, which we can, but they train us for that through the company, like through Hawaii Life Flight.
And a lot of vent training. As nurses, none of us have ever done vents before. That you call RT for that. You don't do that. So nurses specifically, we do a lot of vent trainings, and then
So during a flight, there's not a doctor on board typically. So you guys have complete and total control of doing whatever and giving whatever meds you deem necessary.
Yep, we have protocols that we follow. We have protocols downloaded on our phone, and then of course, you memorize the crucial ones. But you have your set of medications, and whether that be, you have a pain 9 out of 10, these are the meds that you can give for that. Blood pressure is now this. You have blood pressure medications that you can give for those. Pretty much all of our meds and procedures fall under judgment and protocols.
Is there anything out of your guys' scope of practice that no matter patient condition, you can't do it while in there?
Escharotomy.
Yeah.
Doing that.
Yeah, escharotomy we have to have a MD's permission to do.
But most everything.
But I mean, pretty much, if you're at 10,000, 12,000 feet and you can't get a hold of anybody, you got to do what you got to do to make the situation work. And then you can call our medical director when we land, and we're like, hey, this is what happened. This is where we were at. This is why we did what we did. And then you kind of go through it, and you kind of get like a reverse verbal order in that case, because they know that you're not reaching them when you're 12,000 feet up in the air.
To get into a position like yours?
No, you kind of get thrown in.
You kind of get thrown. Okay.
Yeah. I mean, you go to what we call academy, and they do a 7 days. I think it's 7 days now. Academy is 7 days, and there's a lot of training that goes in, but it's like force feeding all that information into you.
Right.
Kind of like nursing school. It's fast and fast paced, and you do all that, and then you come here and you do what's called third rides for 7 days. And you ride with a crew, so it'd be like her and I, and you'd be that third person, and we kind of pull you in like, okay, let's try this skill, you do learn the charting part of it, you do all that, and then after you've been checked off, you're on your own. As far as like, I mean, you always have your partner,
Right.
but you're no longer that third person anymore.
And our educators, we have educators that we can reach out to, questions, and like, checking in on you, and help you out if you have.
I know you mentioned charting. Do you guys do like paper charting, or is that like on your phone or
Mostly computer. We have one piece of paper that's kind of like our like tracker, if you will. It is a part of the official patient record, but it's where all of our vital signs go, our real brief assessment, labs, that kind of stuff. But all the rest is electronic charting. Yeah. On an L chart format. You guys know what L chart is?
I didn't before coming here.
No, I didn't either. Everything nurse-wise was like SBAR and all that kind of stuff.
That
L
one I
chart
know.
is location, chief complaint, history, assessment, rendered care, and transport. See?
Little paragraphs of the whole.
Yep. So we do
rundown
that.
of your flight.
That's like our freehand portion of the chart, if you will, and then all the rest is like checkboxing, similar to like nursing charting at the hospital.
How does medication transport look like? Do you guys like have it in your backpack, or like is there a specific spot on?
Yes, it's us. So we are the fixes.
So that is our walking Pyxis. Medication. So it is more limited than a Pyxis, and then we have our drugs.
Yeah, our narcotics, we carry pretty much, somebody carries it on person. Typically.
Okay.
So if two of you want to go up and kind of take a look at what it looks like in there. We'll do kind of two at a time.
So we have like a little slide kind of thing, and it goes down here, and then this thing slides down, and then the ambulance will slide it up into there.
Wow. Wow, it's really tiny.
It is.
Yeah.
And we can do anything in it, like an ICU can do. We have, so this is an OB monitor, like for monitoring the babies. That's a ventilator. And that is a cardiac monitor that takes their blood pressure and all that. We can do art line. We can do 2 art lines on that. Arterial lines, are you familiar? And then, actually I think we can do 3, but we just have 2 cords. But the ventilator, this takes the place of that huge ventilator.
Right.
This thing is like crazy
This is so
intelligent.
cool.
and
I've
compact.
never seen this before.
Yeah, and it does an amazing job.
Yeah.
So then oxygen hookup. Back here, we would hook up their oxygen, and then if they need suction, that kind of thing right here, we have a little suction canister, and then this can go up and down. We secure them with their straps. Yeah, and then like that's our life raft. Life raft. Fire extinguisher, all the pilot stuff. Do you want to look at that?
That is awesome.
Wait, so usually it would just be like the 2 of you in here, just
So pilot, nurse, medic, or nurse, and then patient. Sometimes we bring family members. Quite a bit we bring family members.
Oh, okay.
And all kind of depending on how sick they are. Like sometimes, like even when you have kids, you're like, sorry, like I have to be able to take care of your kid, and that's our priority. So if it's convenient, we'll bring a family member, but all kind of patient dependent.
Yeah, of course.
And we are just single pilot. Have you heard of the CAP team in Kapiolani? They specialize in the really high risk OB and the NICU patients, and they have an isolette that they put the little kids on. We work with them here, but they bring their team, and then they put 2 pilots up front when they do those.
Okay, nice.
Yeah.
If you guys had to give one advice to anyone interested in flight nursing, what would that advice be?
Get your experience.
Yeah, I tell people get some ICU and ER, like both. For this job, in my opinion, with both is great. ACLS, get your advanced certs. And when you have an RT and is willing to show you the ventilator and work with the ventilator, that's huge. Because we just don't normally do it.
Well, that concludes our coverage tonight, and we hope you've learned about the exciting and skill-driven world of flight nursing. As a parting message, we at 351 Action News would like to remind you that as future nurses, you are in a position to make a difference. The existing system of inter-island patient transport is overburdened, with only one major provider of ambulance services. Certainly, you can make a difference by exploring the possibility of the flight nurse specialization, but there are actions you can take right now. Last year, the Hawaii State Legislature proposed a bill that would fund the purchase of a brand new air ambulance that would be owned by the state and operated by private carriers. This important move would increase availability of transport flights and help control costs, as ambulance services can often cost tens of thousands of dollars, even with insurance. Sadly, this important bill died in committee. So please, call your representatives and ask them to reintroduce State Bill 3126 to help provide desperately needed services in your local community. Well, that's it for us tonight at 351 Action News, and tune in next time for more exciting coverage.